Hi, this is James at ADHD Adult UK. We've had so many people get in touch over the past few weeks about how to get a diagnosis as an adult with ADHD. We thought we'd update our advice in a video. There's currently two routes to getting a diagnosis as an adult, the NHS or private. If you go through the NHS, you'll need to see your GP, and it helps if you take with you, when you first see your GP, some kind of indication of your core ADHD traits. You can fill in a form known as an ASRS, or ADHD Self-Report Scale. There's a 6-question version which is just as good as the longer version, and if you send that to your GP or take it with you, it helps identify whether you are likely to have ADHD. They may ask you whether the impact, or what the impact of the ADHD is on your life, on your job, on your relationships, and how long you've had it. But if you've got a high enough score, that should be indicative for them to then refer you on. Now, the bad news about NHS ADHD services are they're under-resourced, they're underfunded, and the waiting times are very long. So in some places in the UK, you may wait more than 3 years just to get a diagnosis, which is, I'm sorry to say, just awful news. I wish I had better news for you. If you're in England, it's a slightly better story because you can use something known as right to choose, which means you can specifically say to your GP, I want to be referred to this clinic here. And there are two private clinics which are approved for NHS referrals. That's Psychiatry UK and ADHD 360. Both these organisations have details on their website of how you can ask to be referred to them using NHS right to choose. The other route is to go privately. Now this is much quicker. You'll probably get a diagnosis in 2 to 3 weeks, but it's going to cost money. Realistically, you're looking at somewhere between £800 and maybe £1,500 in total for your diagnosis, for your drug titration and your discharge, and you have to make sure that your GP is able and willing to accept you back from your private provider in what's known as a shared care agreement. Some GPs are really funny about this. So I'm sorry there's not better news. If you are looking for a diagnosis as an adult and you need help, please get in touch.